No.
You are live.
We are live. This is the Senate Education Committee on, what is the date today? 24th. On January 24th, we have just completed a joint hearing with House Education, listening to Legislative Council, discuss the history and implications of the Brigham decision. And today we're hearing from the Superintendents Association, the Principals Association, and the VSEA on their, a little bit of just an introduction, who you are, what you do, and a little bit about your legislative priorities for this year. And our first witness along those lines is Jay Nichols from the Principals Association. Welcome.
Welcome. Thank you. Good afternoon, members of Senate Education. Can you hear me okay?
Yeah. Yes.
All right. I'm working from home because I have a meeting in Richford at 5 o'clock today, and I've got two dogs out here, so that's why I have headphones on, so you don't have to hear them. So for the record, Jay Nichols, Executive Director of the Vermont Principals Association. Our mission as an organization is to support school leaders to improve the equity and quality of educational opportunities for all students. A little history on the VPA. We were founded in 1915, and the original name of the organization was the Vermont Headmasters Association. And that association organization was founded by schools to oversee high school sports, to provide guidance and rules that everyone would agree to. And it stayed that way for a long time until about the 1990s. Research started coming out in education about the potential impact of school principals on student success. And that impact and that research has continued to grow. Latest report that came out from a research organization said that the principal, along with the classroom teacher, are the two most important people that schools have control over that impact schools. And in schools, especially where there are a lot of new teachers or schools in poverty or rural areas, the impact of the principal is very, very high because they help set conditions for those people working together to be successful and help the teachers be successful. Before that, principals basically dealt with the 3 Bs, for hundred something years: buildings, buses, and behavior. Now they're more of an instructional leader. So we have about 800 members, and we look to support them in all facets of school leadership, including providing high levels of professional learning support, and we still oversee high school sports as well. And we're a member-driven organization, so virtually every school in the state, any school that plays sports is a VPA member. Almost every principal is a member. Many headmasters and independent school leaders are members of the VPA. And so whatever positions we come up with are based on input from our members. The VPA is governed by a 15-member executive council. It's made up of a retired principal, a CTE director, an assistant principal, and 12 active principals. And the legislative priorities I'll share with you were approved by the executive council prior to the recent transformation proposal shared by the governor. So I'm not going to get into that unless there's direct questions to me around that plan. Does that sound fair enough?
Yes.
Okay, perfect. So do you have the document, or do I need to share the screen?
We have the document.
Yeah.
Of course, people watching don't have it, but
It's available online.
okay, it's available online. Okay, so
Okay.
you're good to go without
All right.
having to share.
Perfect. Thanks, Senator. So our main priority is to protect public education in all Vermont children. That's something that we focus on as an organization, part of our mission. And it's a great organization to work for because the mission is pretty consistent with what we hope most principals are trying to do. Our first big bucket is equitable funding changes. We are advocating at the commission, the General Assembly, and administrative levels. We want to make sure that we're all careful of unintended consequences of any funding changes that take place. We support a nuanced database approach to funding changes. We think that it's going to be important for you folks, the General Assembly, to provide transition dollars to school districts that may be immediately hit by funding changes in a manner that negatively impacts students. It remains to be seen if that's going to be an issue or not. We have a mantra at the VPA: same dollars, same rules. For any changes to education funding for any school or private entity receiving education fund dollars, it should be the same for them as it is for public schools. We also, and I think we say this every year, it would be really good to have no new cost legislation without a corresponding funding source. Let's try to stay away from unfunded mandates. And finally, in terms of equitable funding, we believe that to get school spending in a better place and be more sustainable, we need to address the cost drivers that local districts do not control. even if we go to 5 districts, there's still going to be cost drivers that those school boards may not be able to control. Example, out of control health costs. We're all struggling with that, trying to find a state solution for that. Money being spent from the ed fund that should be coming from the general fund or other sources. Early childhood monies, for example, for private providers who don't have licensed teachers, funds to private schools that don't follow the same rules, even things like universal meals. We fully support that, but we question whether it should come out of the education fund and maybe something that's more appropriate.
Just to be clear, you're calling like the nonprofit childcare centers, you're calling those private? Do you mean? But actually,
Yes. If they've got a licensed teacher, if they get a licensed teacher
then-
provided the instruction, then it's different. If they're receiving ed fund monies and not having the same rules that the schools have for teaching 3 and 4-year-olds, then we don't think that's appropriate use of those funds.
I was referring to terminology, but that's okay.
State educate. Go ahead. Yeah, you can stop me anytime you want. It's just hard for me to tell if you're raising a hand or not.
We have a couple questions.
Okay.
Senator Ron, who's go first?
I don't know if you had any more to say on out of control healthcare costs. I mean, is it the same as everyone else's out of control healthcare costs, or did you?
Yeah, I think it is. I think it is.
Yeah.
And I know the Vermont NEA's proposed has talked about reference-based pricing. I don't know enough about that. The health field is not my strength at all. But I think looking at things like that to find scale where we can reduce the pricings overall. I hear superintendents and principals tell me all the time that their budget increases are oftentimes they can't keep up because of the health insurance piece. They may have a budget that they think is very, very well-intended, strong budget, and then a health insurance increase of 12%. And VPA members, we have the same insurance as teachers do, including people in our office. So we just found out our insurance is going up 12%. So that's a big hit to our local budget, and we know every school is facing the same thing.
Okay.
We don't have an answer.
Okay, that was my question. Do you have any suggestions for us? And just fix it, okay?
Yeah, I think the scale question, Senator, is really if there's ways that we can find scale to do that. Oliver Olson told me a while back that the independent schools had looked at some ways to try to lower insurance costs that were working for them. I think whatever they did is worth looking into. I also think the NEA's idea of the reference-based pricing for healthcare, I think it's Oregon that did that and saw lots of savings. But again, this is definitely out of my wheelhouse, health insurance.
Thanks, Senator Weeks.
If I could. So I'm not sure if you meant this as a policy recommendation or not, but your comment about child care monies related to licensed teachers or in relationship to licensed teachers. So I do recall in the Health and Welfare Committee last year, or maybe it was the year before, that there was a new requirement that the lead of a healthcare facility have a bachelor's. Childcare, what is it?
You said healthcare.
Oh, I'm sorry. Yeah, childcare.
Yeah.
Sorry. That the lead of a childcare facility have a bachelor's, and that the helpers have associates. Are you advocating that that all these direct contact providers also have a teaching certificate? Is that the point?
I think they should be trained teachers actually provide the instruction. What happened for many years, and my understanding is still happening in some places, is that there's a licensed teacher that oversees the program, but does not provide the direct instruction to the kids. And the research is pretty clear that it's the direct instruction that really matters. And we can bring principals in to testify to you that will tell you in places where they have kids coming from a program in their school and kids coming from a program outside their school without a licensed teacher providing the instruction, there's a world of difference in terms of the kindergarten readiness for those kids. And the kids that are in the public school are doing better. Now, that said, there are private providers with licensed teachers that are fantastic partners and are doing a great job, and we don't want that to go away. We just want to make sure that the kids are actually having quality instruction, and there's some safeguards for that, and that usually means a licensed teacher. It could be a provisional license. It could be somebody who's got a bachelor's degree and is in a training program, but they have to be providing the instruction, Senator. And for many years, they weren't providing the instruction. They might be working with newborns in another room, and that counted as them being on site. So that counted towards the instructional hours. It's got to be actually providing the instruction with those kids.
So when you say private providers, I tend to go back to this. You actually mean nonprofit childcare centers, is that what we're actually talking about?
It could be
Because
any
private-
childcare center where public,
implies for-profit. I was just, private kind of implies for-profit, they're actually nonprofit childcare centers we're talking about?
any organization that's providing childcare and using public funds.
Okay, all right.
We want to
Okay.
make sure that those kids are getting high quality instruction, whether it's happening in the school or outside the school.
Okay, thank you.
You're welcome. Should I go to the next bucket?
Yeah,
Okay. The next one's, obviously we're going to have lots of conversations about this, given the governor's proposal. State education governance construct, a solution to the Carson v. Macon case versus Vermont's constitutional separation of church and state provision. We're hoping the legislature will work on that. We have also, over the years, advocated moving from an agency to a Department of Education. We think that an AOE that answers to a restructured state board has a more accurate representation of Vermont students. 96% of students in K-12 attend public schools. We worry about the current construct, making the AOE simply an agency completely under the direction of the governor, and it creates more opportunities for partisanship in politics. And just to speak on that, I want to be really clear. I testified against this as a superintendent when it happened. Our principals have been supportive as a unit. We just think that with a 2-year governor term, that having education be this connected to politics is worrisome. It's got nothing to do with the current governor, nothing to do with the previous governor or anything to do with any governor coming forward. We just think Vermonters are better served by a strong state board that answers to an independent state board of education. And then I guess the rest of it is just adding on to that. The current construct, again, makes the AOE simply a mechanism underneath the governor. And we think that that's a bad policy, especially for a state that has a 2-year governor term.
Senator Weeks.
Thanks, sir. So, kind of new at state government, so I'm really not sure the nuance between an agency and a department. Can you just articulate that a little bit?
Well, an agency basically works at the whim of the governor completely. So if I'm the Secretary of Education and the governor tells me to do X, I do X, whether I think it's a good policy or not, or I resign. It's like and that's how it's supposed to be. Just like when you're working in an executive office in DC, if I'm working for the president and the president says do ABC and I don't want to do ABC, then I submit my resignation. A commissioner that works underneath the state board answers to the state board. And so theoretically, in my opinion, and I think it used to be this way, they are more likely to be focused on what's best for students. They get input from the General Assembly, from the governor's office, from the field, and then they set policy and vision forward for the state. And in my opinion, when we had a commissioner model, we were much more responsive to the field. And we can bring in a lot of principals and superintendents that can attest to that. And since it's gone to a agency, there's been lots of cuts. There's a lot less support for the field. We used to have teams of people from the Department of Education go into the field and provide training for teachers on how to teach science for science teachers, how to give them extra support. We don't have any of that anymore.
Okay.
Yeah.
Okay, thanks, sir. So, thanks, Jay. I still don't get it though, because we currently have an agency. We currently have a state board of education. So how does transitioning to a department require that change or a different relationship?
Well, with the state,
again, I'm familiar with the nuances of the language.
yeah, the state board would actually have authority, and the commissioner would answer directly to them. Look at the commissioner like a superintendent of schools for the state. And the governor could not say to them, you have to do X, Y, Z. They would, under whatever rules were by the state board, and whether the legislation was passed by your body, they would then try to enact that legislation, and they would not have to worry about the political part of it at all. They would just do what was right for kids and follow the laws. Yeah, that's my position on that.
Thank you.
You're welcome.
I think we should have a longer conversation about that at some point. I was here when we made that change, and it really felt like it was some kind of solution to the property tax issue, and it never was. So if we go back to the intent, I just don't think any of it worked out.
Truthful.
It had no impact on property taxes. And I think there's often talk about how we'll save money if we just change this. And just to finish on that little line, as a superintendent association at the time, we were pretty divided on the issue. You know, there were some of us that thought it should be, and when it first came up, it was Governor Shumlin. We thought it should switch to an AOE because it'd make the governor more accountable for education. And that's what maybe a third of us thought, including Dan French, you know, who he and I were officers at the same time in the Superintendent's Association. He later became the secretary. I was against it then and am now because I think it makes it too political of a position, and I worry about the 2-year governor term. I'm not saying that I'm right or somebody else is wrong, but I think in the context of Vermont, I think we would be better served by a Department of Education. And this is not a knock on the current agency. They got some great people there that are working hard. We love working with them. We just think them with an independent state board would be better for the state and for education overall.
Okay.
Okay. And we think the state board compensation should be looked at. That's again would be a conversation. We think you folks should appoint people. We think the governor should have 3 or 4 appointments. The Senate should have 3 or 4 appointments. The health should have 2 or 3 appointments, whatever, board of 11. We think that there should be a principal on that board or a retired principal, a superintendent, a retired superintendent. We think some of those positions should be actually spelled out in the composition. We also believe that, I already mentioned the same dollar, same rules for anybody who's getting public funds for any school. If we've got schools that are doing, that are independent schools and are doing the right thing and admitting all kids, then using public funds is fine. If they're not, then they should be held to those same rules. The pre-kindergarten piece is next. If you saw the reports recently, you'll notice that everybody is now calling for support for full ADM for pre-K kids that are in schools with licensed programs. So we've been talking about that for about 10 years now. We think that is absolutely the right move in anything that we do in terms of funding. Right now, some of our poorer communities, I also use St. Albans City as an example because it's not too far from where I am. They're fully funding pre-K for their kids full day for some of the neediest kids in the state, and it's coming out of their local tax dollars. And that should be a state thing, the same as it would be for kindergarten. And I think almost everybody's in agreement now with that. The rest of that I've already kind of mentioned. A couple one-offs, vaping. We've supported banning flavored tobacco products the last 2 sessions. It's passed and been vetoed by the governor. We hope that you will consider bringing that back to the governor and having some conversations with the governor's office. We know that there's some economic issues on the other end, but our principals are telling me every day about kids that are getting hooked on nicotine through vaping. They're buying stuff for bathrooms to catch kids vaping. I've got principals that are sitting outside bathrooms and desks, so they're working from there so they can watch which kids are going in the bathroom because of vaping. And we're creating another generation of nicotine addicts in favor of big tobacco, and it's really hurting our kids. PCB testing, some of you were on the committee last year, so you know our feeling on this. No funding, no testing. We feel the state should pay for all mitigation, and I'd like to point out that we have put ourselves on a hook for lots of money over the next foreseeable future. We've got some schools now that are in the EPA land where they're going to be tested every couple of years, and we're talking hundreds of thousands of dollars for those schools until they no longer have a building. Reading, we think you should just keep Act 139 the way that it is. We've heard rumors about some changes to it for this year. Principals and school leaders, especially kindergarten through 3rd grade teachers, they need a couple of years to really work on this to get it right. So let's not rush to make changes to legislation that was just passed last year. Adult basic ed, AOE is already moving on this. We've already heard some good things about how they're trying to come forward with the program. As you may know, the law changed last year. We're now 16 to whatever age is considered adult ed if they drop out of school. So we want to make sure that there's a plan for those kids and young women and men to be able to get diplomas in a consistent way. And Vermont doesn't offer like a Vermont diploma. So you have to work with local schools, but we know the AOE is working on this and we appreciate that. And then lastly, subject to any questions at all that you want to ask, we surveyed our members. The majority of them would like to see cell phones out of school. They'd love to see you folks make the decision instead of us. And they're really the big thing is restriction from 8 to 3 for the most part, with some exceptions maybe by, you know, if a principal has to make an exception because there's for example, electrician class and a CTE where they're using their phones because they're plugging into sockets and stuff and reading information on it, stuff like that. But in the main, kids just not having cell phones out in classes and putting them in pouches or in their lockers or something. Our principals that have done that feel that the kids are much more focused. And quite frankly, there's a lot less anxiety. and kids are actually looking at each other and talking to each other. So we think there's benefit to that as well.
Going back to the, we'll get you in a second, going back to the adult basic education, do you have I'm aware of this issue, and do you have a proposal for us about how to do that?
I don't, but Mike McGrath of our office is working with the AOE on a proposal. And when we drew this up 2 weeks ago, we were really concerned about it, and we're less concerned now because we know they're taking input, and it sounds like they're working towards a reasonable solution. So I think they're going to have something for you, Senator, fairly soon.
Okay, thank you. Senator
You're welcome.
So on that cell phone issue, 8 to 3, which I'd be very support of that. How is it as they go into the classroom, they have to put it, have lockers at the entryway, so by the time they enter to the time they leave, but if there's an emergency, they can go get it. What have you come up with a plan to say, hey, this is what we'd like to see?
I think you leave it up to individual schools. Some schools don't have lockers. I know that sounds kind of crazy, but there's some schools today that don't even have lockers. So it might be pouches, it might be little cubbies in the classroom. It might be you just put it in your backpack and that's fine. But if you take it out of your backpack and you're caught with it, first times, my grandson's school, first offense, it's a warning that you're caught with it. The second offense, I think they lose it for the day. And the third offense, the grandparent, in our case, grandparent, because our grandson lives with us, has to come get it. So in my case, my grandson lost it last year. His third offense was on a Friday afternoon, and darn, I just forgot to get there until Monday. So he didn't have a phone for the weekend.
Could you just refresh my memory from last year regarding PCBs? Were private schools also subjected to the same rules and requirements for that?
I think on the original plan I think that they are. I mean, I'm not the expert on PCBs. If Chelsea's in the room, she might know the answer, but I just don't think they've got the private schools yet. I think they started with public schools, but I'm not sure. That's just from my memory, Senator.
Thank you.
Senator Williamson.
So back to the agency versus department. If they became a department, who would they fall under? Who would they be responsible to?
To the state board. And the state board would be selected partially from the governor's office, partially from the Senate, and partially from the House under the proposal that we would support. They'd work for you. They work for state government.
I was working on kids code in economic development and not the cell phone bill here, but would that be considered by you an unfunded mandate unless it came with funding for some kind of materials, pouches or something? Or do you see that as a mandate that doesn't need funding?
I think it depends on the context of the local school and what they can do. I know some places have gone out and bought the Yonder pouches. I know in one case, the superintendent took a lot of criticism because the district bought the Yonder pouches and community members were like, that's too much money to spend on that. I know Lamoille, I believe it's Lamoille South, they did something where the kids keep them in backpacks or whatever, and that seemed to work for them. I think it's a local solution, but I do think we need to be open to providing resources for schools if they feel they need them. Sorry, that's kind of a non-answer. That was a real political answer, Senator. Sorry.
That's a good political answer right there.
Two more witnesses here. So, well, thank you. Thanks for joining us.
Okay, I will listen the rest of the time. Thank you very much for having me, and I thank you for your service to the state, all of you. Appreciate it.
Thank you.
Thank you.
Have a nice weekend.
Yeah, you as well.
So next we're going to Chelsea Myers from the Superintendent's Association. So again, same thing. Tell us a little bit about your organization, what it does, where it came from, and
Do you want me to pull up?
yeah. Oh, there's no chair. I'm sorry. There was no chair there.
Full house.
Yeah. And then there was.
Hi, I am Chelsea Myers. I am the new executive director of the Vermont Superintendents Association. You might remember my predecessor, Jeff Francis, was there for 30 years, and I stepped into that role in August. So I've been with the association for around seven years. And before that, I had roles in educational neuroscience research, primarily around early literacy learning, and taught in the classroom, and then also was trained in education policy. So that's generally my background. Amy Miner, who is our president, sends her regrets. She was unable to make it at this time, but said to express well wishes to you all in the work that is ahead. And so the Vermont Superintendents Association is made up of 56 superintendents and an additional 33 central office leaders and retired superintendents. The work of our association falls within generally 3 categories. One is member services, so we support superintendents with their work in the day-to-day operations of school districts. So I get calls about like different programs that are going on with data collection around the AOE and just navigating some of that and helping them through some of the day-to-day operations of the school district. The next kind of bucket of work is professional learning. We do conferences, academies, new superintendent and aspiring superintendent training and mentoring, networking, and many of these professional learning initiatives have been focused on the implementations of laws passed in the General Assembly. So for example, we ran a 3-year inclusive education project that was to support Act 173. And we also ran a multi-year Act 46 support program as examples. That was before my time on the Act 46, but it just exemplifies how a lot of the professional learning we're doing is related to support and implementation of the laws that are passed in the General Assembly. And then the third is what I'm doing right here, advocating on behalf of superintendents, and working with you all, the state board, the Agency of Education, and other stakeholders to support the work of moving education in Vermont forward for students. We view superintendents as very important change agents for any efforts to improve education quality in the state of Vermont. We are staffed by 2 full-time employees, myself, and then we have an office manager that works at our offices in Montpelier, the offices that we share with the VPA, the VSBA, and then some other entities as well that are in the business of supporting schools. We are governed by a 10-person superintendent board, but currently we have 1 vacancy in the past president position. So we have 5 regional trustees and 5 other officer positions. So what do superintendents do? They provide visionary leadership. So they inspire and guide teams to achieve excellence and align district goals with community values. They develop and communicate a shared vision and lead the implementation of continuous improvement plans to enhance student outcomes. They provide educational leadership, overseeing a comprehensive, inclusive education system that ensures success for all students, and regularly report progress and assessment results to the school board and the community. So the superintendent is the nexus between the school board, and the school board the nexus between the community, although of course that is not exclusive. The superintendent reaches out to the community as well. The superintendent is involved in collaboration and advocacy. They partner with parents, communities, and state agencies to support student learning, engage with other education organizations and legislators to impact policies. And then a big thing on their plates right now is fiscal and resource stewardship, thinking about planning for budgets, managing facilities, and efficiently maximizing educational impact with the dollars that they put in their budget. They are responsible for the personnel management across the entire organization, and Amy would want me to say that a lot of her time is taken up with the last kind of pillar that we put in here, which is crisis and emergency management. So a lot of their day-to-day is trying to put out fires that come up across the organization, and that can have to do with safety or personnel, or it's a different thing each day. Some of them are now PCB experts. They're weather people making snow day calls. So a lot of the day-to-day is just managing some of those emergencies and crises. Just a couple of statistics about superintendents over the past 5 years. In 2019, we had 6 transitions, 2020, 11, 2021, 9. 2022, we had 12, 2023, we had 6, and 2024, unfortunately, we had 15, and we're expecting about an equal amount this year, maybe even a little bit more. That can include interim positions going to permanent, so it's not always a complete change in the superintendency, but we do try to track and see, and we do support those new superintendents. So for example, this year, out of the 15 transitions, only 5 of those are brand new superintendents, and the rest are just movement around from an interim or just from moving from a different position. So just want to share a little bit about what we think is great about Vermont schools. And again, I wish Amy was here because she tells the stories of her school district so well. And we look forward to having some superintendents in here when possible. So project-based learning, outdoor education, farm to school programs, internships, community service. Schools are being asked to be responsible for more of those, what we call wraparound services. So health centers are popping up in a lot of schools, dental services, family services, they're feeding kids. Are welcoming environments for refugee families. There's commitment to culturally responsive teaching and learning, financial literacy and CTE, and some of the fun things that we like to showcase at our conferences and things like that are things like the junior chef competition, the robotics programs, conservation, environmental conservation clubs, and more, and the legislative pages that work with you all. So lots of really cool programs happening across school districts, and we just like to take an opportunity to highlight some of those. You all should have gotten a legislative priorities document, so I'll just quickly go through those if that works for you all. So the core principles for us for the 2025 legislative session is one, that we recognize that change in the educational delivery system is necessary to develop an affordable system for taxpayers, while also keeping the eye on high quality education for students. We believe that VSA plays a key role as change agents to improve equitable outcomes for Vermont students. We believe that all recommendations must address disparities in opportunities and resources to ensure every student can succeed. Legislative changes must address cost drivers. Mechanisms that only aim for cost containment will likely negatively impact students. So if we do the same with less dollars, we're likely to only impact and hurt students. So any change needs to be comprehensive in nature. Making changes that avoid unintended consequences for students will require a comprehensive understanding of the delivery system. 6, the education system does not operate within a vacuum, and you all know that. You were just all talking about healthcare, but it's deeply intertwined with the state's education delivery system, childcare, environmental, for example, PCBs, workforce challenges, and healthcare needs. 7, any changes must recognize that FY26 budgeting is underway, and I would be remiss to say that it's more than underway. Many of the budget warnings have gone to print, so we're more than underway at this point. So our priorities. The first pillar of priorities is around education funding reform. We believe that it's critical to address the spending disparities in our current system. We roughly have a range of $10,000 to $18,000 per weighted per student in our current system, and I think that gap was bigger last year actually than this year, but still pretty dramatic. Any overarching changes to the funding system must be properly modeled and ensure adequate funding for high quality education. We ask that you think about doing an education fund analysis, so conducting a full analysis of the use of the education fund to ensure dollars are directed to educational purposes and not diverted to non-educational items. I would also suggest that taking a look at what initiatives have been passed in the past that maybe are no longer serving our school districts now. Things tend to be added to the plate but never removed if it no longer serves a benefit in our school district. So that just compounds over time. So taking a close look at that. And then
are you talking there about?
Yeah.
You talk about education fund dollars directed to other purposes. You talk about the legislature doing that?
Yeah, like I'm talking about what we would typically refer to as off the top of the education fund and like what those dollars are. But also, other initiatives that are borne out in, local school district budgets and maybe were passed 20 years ago that are no longer reflective of the current, time period and what serves, students well now. So just to look at that, kind of a legislative audit in a way. And then pre-K funding, agree with Jay that we would like to revise the funding formula to incentivize public schools to run pre-K programs, having that full ADM count for the pre-K programs that they are running so that it supports those programs. We do feel like pre-K is essential to the delivery system in Vermont. And then the next bucket is around instructional delivery size, and structural change. The first bullet on there is class sizes, and we put that first intentionally because of a couple reasons. One is we already have the framework in which class sizes are set in law. So it would be, we would have that kind of the basis for which that change could be made. And one is the education quality standards, which currently sets the maximums, but not the minimum. And then also school districts are required in Act 153 of 2010 to have an optimal and minimum class size policy. Those vary across the state. But the vehicle is there, and superintendents believe that is a way to think about instructional size and quality of instructional delivery.
Can I ask, is there a best practice minimum?
Yeah, I was anticipating. So the research around class sizes, particularly around minimums, is not super well fleshed out, and even around maximums is not very applicable to Vermont, because when they're talking about maximums in large class sizes, they're talking like 30 and or 25 to 30. I did meet with superintendents yesterday, and we did workshop that, like taking the research that does exist. It's not quite ready, but I'd be happy to write it up and send it to you all, what kind of like we're thinking. But we're not quite ready to like give a range of numbers or anything like that. But I think that we have thought really carefully about this. We had about 45 superintendents in the room at the time kind of debating with each other and talking about it. And we had done like kind of a deep dive of the research too first. So I'm happy to share the results of that, but they're just not ready yet.
Is every district now has their own minimum? Do you know what the lowest is there?
Yes. If I don't want to get it wrong though.
Okay.
Can I email you
Yeah,
after? Because we did pull a number of those policies to just get like kind of a range. If I remember correctly, the minimum was 10 on the ones that we did find on websites. Some of them were a little bit harder to find. So it's not super comprehensive, and I don't want to represent anything. So I'm happy to give you guys additional information later.
And do they tend to create like a second and third grade joint class if they go below that?
Yes. Yep. Multi-age classes. And it's an average over schools, which superintendents have indicated is really helpful because it can account for like a smaller world language or a smaller AP course, or one grade is one class is a lot smaller than another, and so it's an average, and it just makes it a little bit easier to adhere to those policies. So second on the list is staff to student ratios. I think you've heard about the statistics around staff to student ratios. What the feedback is from superintendents is that there's not a clear and consistent way for calculating this yet. And we'd like to move to a clear and consistent way. For example, contracted services could be counted differently from one district to another, and just there's some inconsistencies with reporting, and so we'd like to get clear on that before making any recommendations around policy around staff to student ratios.
And when you say get clear on that, do you mean us getting clear on that for you, or do you mean the Superintendent's Association coming together and
I see it as the role of the agency of education, clearly defining the data process for school districts and getting consistency around that.
Thank you.
And they might have a different view of and feel that it is consistent, but superintendents generally speaking feel that there's not complete consistency around that, and that efforts in the past to kind of think about that have been thwarted by some of those inconsistencies and a feeling about fairness, if some are counting and some are not, and that sort of thing. So that's where the superintendents are around staff to student ratios. And you tell me if I need to speed up or slow down or whatever. Okay. Okay. I'll speed it up. District and school efficiency, identify the optimal size of schools and districts to improve efficiency and increase equitable opportunities for students. We think that work, if you were to tackle class size and education quality standards, could kind of coexist within that. It's not currently the district and school efficiency. No metrics are included in the education quality standards, but that could be a way to dig into that pretty synergistically if you were to pursue the policy lever of the education, education quality standards for class size.
Can I just, for a future bookmark, I mean, a lot of this seems to come back to class sizes, and I just would intellectually wonder why grade 4 through grade 12 are all the same. That just seems like a big range.
In the current EQS?
Yeah.
I was not around when those standards were developed, so I don't know what the reasoning, and maybe Jay does, if he's
so
still
just
here.
like marking for the future that just strikes me as very broad. And
yes, the policies that are required under Act 153 of 2010 are not within those grade bands. It's usually like K through 2 or 3, and then 4 through 6 or 5. Like it depends, but there are definitely more grade bands defined in the school board policies. School designation, we feel like a requirement for districts without their own schools for certain grade levels to designate up to 3 schools to serve as the allowable schools of the district. This ensures districts without schools for certain grades still meet the educational needs of their students in a more efficient delivery model. So keeping some kind of guardrails around like things like being able to support transportation and other of the ancillary pieces that school districts help to provide when there are multiple schools within the system. Facilities modernization, use of Vermont's facility condition analysis to guide investments in modern, safe, and efficient school buildings. I don't need to tell this committee that we have a bit of a challenge on our hands in terms of the dollar amount that is required to modernize, and even just to make our buildings safe and healthy is quite drastic. And any of these changes that we're recommending is kind of contingent around where we decide to invest money in facilities, because we feel like strong, healthy and safe and if possible modern facilities is essential to high quality education. The next pillar is around education quality. We ask that you maintain a focus on a collaborative vision for high quality education in Vermont. The commission was put into place last year, the Commission on the Future of Public Education. I think part of their role is to help to facilitate that. They're doing a lot of public engagement sessions, but we should be keeping an eye on what is it that we want for our students now in 5 years, in 10 years, in 20 years, and how do we make sure that any changes for example, to education funding are in alignment with providing that to all students. And then the next is strengthening and developing the educator workforce by fostering robust partnerships with higher education institutions. There were some great incentive programs that you all put into place a number of years ago. There's great Grow Your Own programs. The NEA has a great program in helping support early teachers, particularly in the content areas and geographical regions that struggle the most to recruit high quality educators. One of those is special education. we feel like any changes to the education funding system must not put an unequal burden on public schools. It should be applied equally across the entire delivery system, including independent schools and pre-K programs. And then around mental health, schools are seeing a very big uptick in the number of services needed to support mental health, and are taking on more and more in supporting students' mental health needs. And so one of the recommendations that we have is providing clarity on funding responsibilities between education and human services. Some of the services that are now provided in schools were once provided by designated agencies, and so the cost is reflected now in our current system of taking on those needs. And of course, schools are up to the task because they want to support students' learning, and mental health is critical for that purpose.
Go ahead.
Did you just say you have like a cost figure for that?
I do not.
Okay,
I think
if someone can
I
get.
think JFO has attempted it several times.
Oh, interesting.
And so I think if you could potentially get a historical record of some of that work that they had done, because I remember my first year actually here, I was asked about it, and I think they did some accounting around it.
Okay.
And how did that shift take place? Was it just of necessity filling the schools, of necessity filling in and taking on it, or was it more programmatic than that, or more planned than that?
I think it's multifactorial. One thing is, I think that we are seeing increased mental health needs in youth, particularly after the pandemic. So the need has increased. And then in some areas, the designated agencies have kind of downsized, or in some cases gone away altogether. And so we still need to support those students. And what is actually happening is that schools out of necessity are kind of recreating mini designated agencies to the best of their abilities in 56 environments, and that's not super efficient. And they didn't originally get into the business of mental health services. Again, not saying that they don't rise to the occasion, but we want to make sure the most highly skilled and trained mental health professionals are in front of our neediest kids around mental health, and are equitably distributed across geographical regions as well, and not just for those school districts that can recruit high quality mental health professionals.
We are, I think it's fair to say, we're all very much aware of this.
Yeah. We ask that you look at Medicaid expansion and efficiency. We hear that the paperwork involved in Medicaid reimbursement is very cumbersome, and doesn't actually help to effectively draw down funds from Medicaid for schools. And then Vermont has chosen to, or if it's by choice or just it hasn't changed, but the federal government has said for a while now that students without IEPs are eligible for Medicaid services. But to the best of my knowledge, Vermont has not made that expansion. So looking into some of the reasoning why, I admittedly am not an expert in Medicaid, but am reporting some of the things that we've seen and heard from the field.
IEPs means?
Oh, individualized education plan. So it's for students and social services. Yeah. All right, school construction and facilities age. We talked about that first one, so I'm just going to go to the more nuanced pieces. Last year, you implemented the excess spending threshold, and included in that excess spending is capital reserves and bond projects, and it's included in the excess spending, and it's in some cases deterring people from doing necessary facilities upgrades and needs because they're afraid of going over the excess spending either this year or next year, depending on the life of the bond. So reconsidering that component of the excess spending threshold. And then I can't say enough the challenges with the PCB programs and superintendents and principal schedules. Some of them are spending like day to day, like their whole time on remediating PCBs and navigating that program. And so we ask that you halt testing and reimburse those places that have already taken on mitigation. It's a long haul for many of them. I recommend that you hear about like the North Country story, for example, that had to put up tents and were late starting school because of finding PCBs, and just thinking about that more comprehensively, that we're not expanding testing too quickly without actually worrying about the places that have already been identified, because they are on the hook with the EPA. They do need to mitigate and remediate those PCBs. And some of them are feeling quite isolated right now because it's a full-time job to try to make sure that kids have a safe learning environment and stable learning environment as well. So I'm going to echo something that Jay said, but kind of frame it a little bit differently. We feel like there needs to be an examination of the statewide oversight structures of education in Vermont, including the relationship between the state board and the Secretary of Education, to ensure proper checks and balances, such that one branch of government does not have total authority over appointments. So currently the governor appoints all state board members and the Secretary of Education. So regardless of who the governor is, we feel like there should be a little bit more checks and balances within that regulatory framework for the state. And then lastly, when you're considering any new legislation, please consider requiring that there is a sustainable funding source to support new legislation, and that there's adequate time to effectively implement some of the programs that have been initiated. Some really big, good programs for student learning have been initiated in the last several years, and there needs to be time to implement them effectively and with fidelity. Thank you for all the time.
Is that literacy program in particular?
Act 173, like a lot of the programmatic, like people are in full swing with the MTS, the multi-tiered systems of support, and doing really good work. It just takes some time. Yeah.
Thank you. You went through a lot quickly, so.
Yeah. Thank you.
Yeah, thank you very much.
Thanks for having me.
Thank you. We'll see you again.
Do you want that seat back over?
Sure.
Who's next? Yeah.
Actually, I'll
And then
leave.
he can. Yeah.
You can pull that.
Bring your own chair.
Yes, bring it.
So are there, I mean, you can come up together if you want to. You can do it either way.
You've already moved once.
Shuffling cards.
Good afternoon.
So, yeah, introduce yourselves, and so we have Jeff Bannon and Colin Robinson from.
Don Tin. So, first up, Colin's behind us. Yes, okay. Good afternoon, Jeff Bannon, Executive Director of Vermont NEA. Alongside.
I'm Don Tinney, a high school English teacher from South Arrows, president of Vermont NEA.
Okay.
And behind us is Colin Robinson, our political director.
Okay.
We brought most of us. The other person you might see here is our general counsel, Becca McBroom. She wasn't able to be here today, but you may see her as well. So that's the group of us who you often on may see. So
same thing. Give us an overview
Yep.
of who you are, what you do, and then work down to. Yeah.
we'll do. We'll do. Hopefully, if you have any questions along the way, please.
Okay.
Don't hesitate. Thank you for inviting us to talk with you today about Vermont NEA's priorities, who we are, and about what we do, and how we can work together to ensure that every student can succeed and become a happy, productive adult. And as I said, I'm Jeff Bannon, the Executive Director of Vermont NEA, joined by Don Tinney, who's the educational expert in our office. He's a 31-year English teacher. And Colin behind us, and Beck, as I said. So Don will give you a few extra comments as it relates to the field and what he sees and as being the teacher expert that he is. Vermont's public schools are the centers of their communities where generations of students have learned, explored, played, and thrived. And not to brag, although I like to, I really do. Our schools then and now have consistently outperformed nearly all of their peers across the country. That doesn't mean we can't do better. But as I boast of our schools to my peers around the country, they are envious of our success that we have and the significant involvement and support from Vermonters have given their schools over the years. That support didn't happen by accident. Vermonters, including legislators, invested in their local public schools because they and you know how crucial top quality public education is to our future. They and you also know that for most cities and towns, local public schools are huge economic development drivers. Excellent local public schools are, simply put, crucial to our state's growth and success. That remains true even after the unprecedented challenges our public schools faced and met with the onset of the global pandemic. Indeed, what the pandemic showed us was that our schools are safe havens for kids, a provider of meals to all students, a place where students and their families can rely on even in times of turmoil. And behind it all are the state's dedicated public school employees, the teachers, paraeducators, school nurses, cafeteria workers, custodians, bus drivers, librarians, school counselors, administrators, and school board members. They all work hard to ensure that the ravages of the pandemic don't prevent our state's children from getting the education they need to and deserve, and they meet the unique needs of today's students every day. I'm proud of our schools, and you should be too, but that doesn't mean we don't have challenges. Vermont's public schools, and we talked about it a few minutes ago at Chelsea, are strong economic drivers for the state. The schools are achieving and recovering still from the pandemic. And these realities must be recognized. The mental health system in the state is broken. Don and I met regularly during the pandemic with then Secretary of HS, Mike Smith, who heard that the mental health system had collapsed in the Northeast Kingdom, and the worry was it would collapse elsewhere, and it has rolled out, and as Chelsea pointed out, schools have stepped into that breach. They should be applauded for that and not criticized, and certainly the expense that's associated with picking up what had been a general fund obligation and now been shifted to the education fund should be acknowledged and pulled out of the education fund and put back to the general fund. I'm sorry that Senator Ron Hinsdale is not here. The Agency of Education last February, in Ways and Means, identified the additional cost for mental health services to be in the neighborhood of $50 to $60 million additional dollars last year alone. So it has been quantified. It's an ongoing growth number. I know Libby Bonesteel, the superintendent in Montpelier last year, testified that it was a $10 million added number to their budget alone. So those numbers are significant and staggering in some ways, and certainly previously had been a general fund obligation that's now been shifted to the property tax. And the schools picked it up because they had to, and should not be criticized for that. This year, we will focus our work on providing schools with the resources and people they need to respond to the social and emotional needs of students. There remains a shortage of teachers and educators, and all of us must devise ways to ensure that Vermont continues to attract and retain an excellent public education workforce. During the pandemic, as Chelsea noted, Vermont NEA stood up a program called Grow VT Ed, which is evolving, and Colin can talk about that when we want to really dig into that program. I think you did that jointly yesterday. I'm sorry, with you and House Ed.
Yes.
Apologize. Forget that. We graduated more teachers, than any other entity in the state in the last couple of years. We are working hard at making sure that Vermont's students have a highly qualified teacher in front of every classroom. Attached to my introductory remarks is our legislative priorities. But first, I'll segue to Don a little bit and see what he's hearing from being the actual educator.
Sure, thank you. Thanks for having us. Really appreciate being here. I think I reflect our membership in the sense of being many of our members are lifelong educators as I have been, and come from a family of educators. My mom began her education career as a school lunch agent in Colchester. I went back to UVM when I started first grade and became English language arts teacher in Grand Isle for 25 years. And I started teaching at Vermont Academy in the 80s and went to Middlebury Union High School as a teacher when I became president of the National Council of Teachers of English, when I was involved with the writing of national standards for language arts, and eventually made my way to BFA St. Albans, where I taught till I left in 2018 to take this position. I just share that with you because I want to let you know that being special interest lobbyist was not my goal in life, but here I am as I speak up to you folks today. One of the things, and Chelsea has mentioned it, Jeff just mentioned it, student dysregulated behavior is the #1 workplace issue that our folks face. And I would like to caution us to from saying that this is a result of the pandemic. We saw the beginnings of this pre-pandemic. Our children are growing up in a toxic culture. Digital devices, social media are part of that. And we need to acknowledge that, and also acknowledge that while our students definitely need mental health services, the behaviors are having an impact on the mental health of our educators as well. And so we need to continue to support them. Also, just want to remind you folks, and I think this is one thing that if we did not learn from the pandemic, that public schools are an integral part of the public health system, we didn't learn anything. And we need to support the work that our school nurses do. I'm very concerned. I'm hearing that some of those positions are being reduced with next year's budget, which will be voted on in town meeting. And the reality is that the school nurse is the primary care provider for hundreds, if not thousands, of our students, particularly in rural areas. So something for us to all keep in mind. But our folks are busier than ever, partly because they're having to do double duty because we have such a shortage of substitutes. So one of the things that we know that we often ask, can you come in and testify in the State House? They're just absolutely exhausted. We have trouble sometimes getting folks to attend conferences because they simply cannot get substitutes to live. So I could go on, and I usually do, but I'll turn it back.
So go into quickly about the school nurses.
Sure.
There's actually a shortage of school, it's very hard to get school nurses.
Yeah, absolutely.
Right?
Yeah.
So are they, when you talked about them being left out of the budgets, is that almost because they know?
I understand, my understanding is some of them are being ripped and some of them are in positions that have not been filled.
Yeah.
So I think that's the piece that we're very concerned in. You know, in addition to all the medical emergencies that happen in the school, right? So we recent years, justifiably so, we're very concerned about school violence and school shootings. We've put a lot of effort into that. But more kids are hurt or injured through a medical emergency in school, right? And this, whether it's, you know, allergic reactions or what have you, folks, the school nurses need to be there.
Yeah. My wife is so the school nurse, so I do this.
Thank you so much. Would you like to testify about that?
All right, so I'll just, who is Vermont EA and what we do and that kind of thing. The organizational basics, as I call them. We are an affiliation of local associations. So we have local affiliations, local affiliates around the state and every public school in the state, as well as we represent the teachers in Burton Academy and Thetford Academy, two of the four historic academies. There, I think, that includes teachers and support staff. So paraeducators, bus drivers, cafeteria workers along the way. I will occasionally slip up and just call them teachers or educators, but we represent both teachers and support staff in schools. Our membership is about 13,000. It includes retired teachers, but it's mostly active teachers. We're governed by a structure of a 20-member board of directors. Don is the chair of that board. But that consists of teachers and support staff members from around the state. So once a month, we get real world what's happening in your school. We hear from them directly, and they've got things to say, and they speak passionately on behalf of their students and their colleagues. And then other staff at Vermont EA is about 23 staff members. Not exclusively, but almost so. We hire educators who have been in the school. Our model is we teach our educators how to bargain their local collective bargaining agreements and then administer them with management and navigate challenges. We think it's much better to have local people dealing with local concerns and issues, much closer to the ground. So if there's an issue about a playground coverage or a bus duty or something of that sort, it's a whole lot better if somebody right there who knows the system makes those decisions and they have a conversation about it. So that's our model. But consequently, a lot of these educators come up and we end up hiring them as staff people, and they assist the local people who bargain a contract and administer them. And administering them means sometimes filing grievance, sometimes negotiating and having discussions with superintendents and management on how to solve problems before they become bigger problems. So that's our model, and consequently, you know, it's not, we have 2 lawyers on staff. Becca's one. She's not here with us today, but she will be on occasion. We don't send lawyers to the table, to the bargaining table. You hear people say, oh, Big Vermont MEA sends the lawyers to the bargaining table. It's simply not true. We send educators to the table to have discussions with their school board members, and sometimes they're assisted by another educator who works for us. That's our model. And lastly, Vermont MEA is an affiliate of the 3 million member NEA at the national level, which is the largest labor union in the country. So that's who we are. A couple things that came up in your Jay and Chelsea's testimony, I thought it might be helpful. Reference-based pricing, excuse me, is we do talk about that and advocate for that, as Jay pointed out. That's found on page 4 of our legislative agenda. And really what it is, it's establishing a reference by which hospitals, not all hospitals, will charge, in our case, VHI, the Vermont Education Health Initiative, but it could be school employees, public employees, and we think it actually should be all members of all Vermonters should be covered by the reference-based policy, pricing policy. And currently VHI is being charged more than 3 times the Medicare rate. We think it should be closer to 2 times. That's plenty, we think. It's been done in Oregon, in Montana, and several other states. Oregon, Montana by state law, I believe, North Carolina by executive order. It has saved hundreds and hundreds of millions of dollars in those states. So Oregon, for example, did it in 24 of the 67 hospitals there. It doesn't have to cover all hospitals, it doesn't have to cover all people. We think it should cover all people in Vermont, maybe not necessarily all hospitals.
And they went in and negotiated that price, correct?
In Montana, what happened is they set it at Medicare at 200%, plus 200%. The current governor, I don't know if several years ago, I don't know if he's still current guy, I don't keep track of Montana politics, allowed Blue Cross Blue Shield of Montana, I guess, to negotiate separately with the hospitals, but required it to be no more than Medicare plus 200%. So there's a sort of a floor or ceiling, you know, a mark, and they could have done better.
I'm sorry.
I guess it's a ceiling.
That's right, and this is going down the healthcare rabbit hole.
Right.
Well, I had heard about it and hearing that they've actually are using it and saving millions of dollars.
There's lots of money.
The problem with it is, this is something that we're not going to get into, the healthcare community into this, is that there's the cost shift, and it comes from that, and then it gets theoretically moved on to private pay, which is already paying for Medicare.
Right.
So we have to, but that's beyond our pay.
It's an interesting conversation. I had it with the chair of the House Education Committee some time ago, the concern about the cost shift. And in reality, it hasn't happened in Oregon or Montana, because 200% of Medicare was more than some hospitals were being paid already. So there was a bump up in Oregon, for example, for several hospitals. So there was no shift, and they have not experienced a shift. We've asked that question. It's an interesting question. And you're obviously right. It's going to be a healthcare conversation, but it does spill into schools and their budgeting. We actually think the projected 5.9 increase, half of that is due to healthcare costs. It's a significant driver. And while VHI, Jay pointed out, they have I think it's 11 or 12%, I think it's 11.9% rate increase for their premiums. That's lower than any other group in the state. It's fine. And the 11.9% is a challenge for us and everybody. Right? Healthcare costs are up for everybody. We're not unique to that, but our rates right now are lower than anybody else's rates. Increase, I should say.
Lower.
Our increase is lower than any other group. Yes, it was confusing. I'm sorry.
Yeah, we're very much aware that it's a real cost driver for schools. So
correct. And Vermont generally has the highest premiums in the country. Yeah, really. I mean, just for all across the board. Yeah. Why is that? So, anyways.
We're one of the healthiest states, which is odd.
Well, we need more kids and families, so we need more healthy payers.
Absolutely.
We're all getting old.
Beats the alternative.
I don't know.
And then lastly, there was some discussion about IEPs, individualized education programs, under the IDEA, Individuals with Disability Education Act, I think from 1974. That bill, that law is what's commonly thought of as the special education law. And at the time, Congress said Congress would foot 42% of the cost of special education. Has never happened, not once. And notwithstanding our then House of Representative member Jim Jeffords and later Senator Jeffords, who was dogged and tenacious to get full funding for an IDEA. He never got it, sadly. So we never got to 42%. I think this year we're at 13%, as low as 9% over the last couple of years. It has hovered around the 10, 12, 13, 14% of late, but nowhere near and never approaching 42%. I think the highest I ever saw was 18% since the passage of the IDEA in 1974. So Congress has always left to local states, local communities to pick up the cost of special education, even though it's a federal obligation. It's an obligation we want to have. We want to make sure we educate all these kids, whether they have special needs or not, but it does come with a price tag. And Congress hasn't taken care of its end of the bill. Anyway, I thought that would be in response to some questions that came up about that. But we'll be around all session. I'm sure we'll engage with this committee as you seek answers to many questions you may have. But happy to sit here today and answer any of them. Yeah. So, any questions from the committee?
Yeah. Sure. Any first reactions to the briefing? Was it Wednesday?
Was there a briefing?
Presentation.
We're certainly waiting for more details, for sure. I mean, I think one of the things that we were surprised about, that we've been saying all along, that our middle class taxpayers need a break in the property taxes, and we were hoping that there'd be more specifically about that, you know, in the short term and in the long term sustainability. So I guess it's in the details somewhere. But you know, we've heard from some members who were just surprised, like what does it mean, right? But I think the centralization of all the power to Montpelier is cause for concern.
But what do you mean by that? Just kind of the notion of foundation formula?
Foundation formula, reducing to 5 districts, you know, elimination of school boards, essentially. And I think that's you know, our communities are built, our schools, right? And to say now that you're not going to have the authority to run your school after you've built your school, I think is a bitter pill for many.
But we are engaged and will remain so. And there's a lot of details that have not yet been
right. I mean, and through all of this, we have to make sure we're meeting student needs, right? So I think that we talk about any funding formula, you have to who's deciding what that formula is, what's the amount of money, and it cannot be dependent upon an out-of-state consultant as a model, as some figures to add, right? We have to really dive in here, and the folks from Chelsea's organization, our organization, school boards, and really figure out what is the cost to provide high quality education for our students. Let's look at where our students are doing well, what the best programs are, and say this is what it costs and how are we going to provide that, as opposed to, you know, doing what a consultant says to do in terms of this particular formula. It won't meet the needs. So, I mean, that's what our concern is.
Yes.
Is there anything you'd want to say about the current picture of reduction in force and cuts that are more imminent with school budgets?
I'll just say that over the last weekend, I got a text from my cousin whose kids are all grown up, but she's in Williston, and her kids went to the music program, And she was like, just, her word was disheartened to find out that they're cutting a music teacher. So, which will reduce the program offerings. And that's, I mean, I know it's one person with one cousin, but we're hearing that around the state, that this is going to have an impact on the services and programs our students have. We've seen that in Spalding, we've seen it in other places, but CVU is, forget the exact number, I think it's in the whole district over 40 or something. So there's real concern. The other thing that is happening is that part of the reduction in force, it happened last year, that because we have so many vacant positions, particularly support staff and other positions as well, those vacant positions were cut. Now, we still see those as a RIF, right, reduction in force, but it's not an actual person losing their job. This year, we're seeing the actual people plus the vacant positions being eliminated. So, and those budgets are all due this week, next week. Like we'll have a, is that? It depends which system. I know Essex is later, so they have bigger cuts as well. I think we're 4.
Yeah, we had a staff meeting the other day and trying to get those numbers because they're not all fully baked in the budgets. That is, we think it's in the neighborhood of 300 to 400 statewide. So if that were one employer in the state, we'd be jumping up and down, doing everything we could. Part of the labor would be there. And we've been hearing from the governor about, we need to help.
That's under the existing system.
Correct. That's the existing system. That's what Senator was asking.
So people are losing their positions, but yet, now, beginning of the statement, we said we didn't have enough people to fill positions.
Right.
So can some of the people that are losing, do they have another position they're going into, or are they just totally out of a job? But
I think there's a bit of both, right? So if you are qualified to do something else, yes, you might you might have rights to move into that position. But if you're not, and if they seek teachers are licensed, for example, so you may be licensed as an English teacher, as Don is, but he would not be licensed perhaps as a special educator.
Special education, probably the highest rate of shortages. Math and sciences historically also been. So it's not a one-to-one, but there are some folks who, particularly in support staff ranks, there may be other positions in other districts, but they're not in a position to pick up and move, right? So
the house.
The housing, yes. Are you gonna take on the housing issue? It is a little after 3. I don't know if we have time.
We did that this morning.
But it's it has become increasingly difficult to retain educators. And then to recruit educators. We're seeing nationally about half, if not more than half, of young educators leave the profession in the first 5 years. And a lot of that is salary, a lot of that's working conditions. So, and now we have, add to that the concern, am I going to have a job next year?
Yes.
Well, actually, speaking of the ongoing conversation between housing and education, we were hearing this morning from home builders who are having a hard time finding qualified carpenters, skilled workers. Do you all represent the CTE folks as well? Do you all have thoughts on how to rebuild some of our more technical education so that we're graduating that workforce?
One of the ideas I think is a good one is to start CTE programs earlier in students' careers, that we not wait till grade 9 or 10 to have them thinking about it and then fully enroll in 11 and 12. So I think if we introduce that, I think we are paying the price for that college for all view that we had for the last 25 years or so. I forget when it was. I could still see the posters about you're going to earn so much more money with a college degree. Right. And so I think the unintended consequence was a disrespect for the trades. And it's like a lot of students said, oh, I've got to go to college. I used to tell my students all the time, it's like, well, you know, you want a career that can't be shipped overseas. So if you want to go in HVAC, people don't ship their furnaces overseas to have fixed,
Right.
where, you know, IT jobs can be. And so there's a lot of, I think, shift in that, but we have to continue to do a better job of honoring the trades, because they're needed, and our students need to see that they are in service to their community. Someone who goes into auto tech is providing a crucial service of providing safe, reliable transportation to members of his community, her community. So, but you're right, the building trades have been really struggling.
All trades.
All trades. We had a great program at BFA St. Albans, you know, but those guys can go anywhere, work anywhere. Well, I say guys, there's a few. That's another piece, is trying to get women engaged in the trades as well.
Are there particular challenges for the notion of introducing it in younger grades, which makes intuitive sense to me? My guess is it's harder to do it there than it is high school.
Right, for sure. I think part of it is how do you integrate that into a middle school program? Some middle schools used to have, you know, introductory shop classes and things like that, and I think a lot of those have gone by the wayside. I think we had an old view of what shop meant, right? And but there's a lot of exciting opportunities. I think one of the things that may happen as a result of the focus on STEM education, that may be a good way to build interest into programs, because there's nothing more STEM than building a home, right? And so I think if we were to continue to focus on and that area, not see STEM as like sending people to Mars, but it's about providing good, solid skills to build homes.
And introducing STEM earlier. Sixth, 7th, 8th graders as well.
Right.
Okay.
Kind of applied STEM.
Yeah, applied STEM.
Yeah.
Any other questions?
I know mitochondria is the powerhouse of the cell, like we talked about yesterday or 2 days ago.
All about the mitochondria.
Well, thank you. I'm sure we'll be talking again.
Thank you very much.
Thanks.
Yeah, thank you.
Have a great weekend.
Thank you.